anything that can expose a woman to human papilloma virus then becomes a causative scenario within which you can get cervical cancer. And so preventing us from getting from getting human papilloma virus is managing the cause. And it goes in a number of ways. You can address the situation before the woman is even exposed to human papilloma virus. And that is where the vaccination comes in. So you receive a vaccine, which will then make your body more alert to the virus, so that when you get exposed to the virus, the body is already primed and can get rid of the virus more easily. This program was also rolled out in Ghana last year, where there was an immunization program for girls in lower secondary to have this immunization for free. And I think that is a very laudable way to go. Of course, there are also the paid versions of the same that people who miss this out. But the plan is to incorporate this into the regular immunizations that girls receive. And that is the first form of prevention. The second form of prevention is checking to see in a regular fashion whether one has persistent HPV or changes on the cervix that could become cancer later on in life. Remember, cervical cancer is not a disease of the young ones, but you need to be about 35, 45, 55 in that age range to have given the virus enough time in your body to transform the cells of the cervix into cancer. So it does take 10, 15 years type of timeline to cause that to happen. So we have an opportunity to test the cervix. Either you are looking for human papilloma virus presence, or you are looking for changes of the cells themselves to see whether they are starting to develop some early stages that could then become cancer later on. So most people know this as the pap smear screening, right? And now also the human papilloma virus screening. So that's the second part. When you are screening for those things, you don't have cancer yet. In fact, we are not screening for cancer at that stage. We are actually screening for changes that could become cancer as we go along, and then treat those changes before they turn into cancer. And so that is a window of opportunity. And cervical cancer is unique in that it has that kind of window. And then the third part is, should you have some changes that could become cancer, or even a very early form of cancer, then quick and early treatment can be instituted at that point before cancer spreads and goes further. Then the fourth part is when you have cancer that has already started spreading, that is slightly more advanced and requires treatment for cancer. Then it becomes cancer treatment, basically radiotherapy for that. So that is